the timer, and here is your question. Okay, so if you have read and understood, considering its surgical anatomistation, kindly please tell me what kind of image are you looking at in picture A and B?
Yeah, like CT head.
Okay. And what are these arrows pointing at?
This arrow for air sinuses, or just 1 second, Mom. This arrow for area of fractures.
No. Have you ever heard of term diploic veins?
Yeah, diploic vein. Okay.
What are diploic veins?
Diploic vein, it is like a vein arise in the scale bone and drain in the diploic space of the skull, and drainage in the venous venous sinuses in the venous sinuses. Just I forget one thing in the middle.
How many types of major diploic veins there are, or there can be?
We have like a measury vein and diploic vein, right?
Okay, so diploic veins, there are 4 major types of diploic veins, which are found on each side of the head: frontal, anterior temporal, posterior temporal, and occipital. Okay. So these are those. All right. Can you tell me if you identify, please, the structures from 1 to 8, please? What is 1?
Okay. Where is 1? Just 1 second.
Yes, one is here.
Okay. Yeah, 1, it is area of straight superior sagittal sinus.
2, please. This is 2.
2 straight sinuses.
3, please.
Just 1 second. Yeah, it is like a conflict sinuses, or this is straight sinuses.
4.
For the sigmoid sinuses.
5, please.
5 inferior petrosal sinus.
6, please.
Superior petrosal sinus.
7, please.
Cavernous sinuses.
8, please.
This is sphenoparietal sinuses.
Okay, broadly, how would you classify dural venous sinuses?
We can divide it like paired and
unpaired
and single, and yeah.
Okay, so how many are paired and how many are unpaired?
Okay, we have like as a paired, we have the cavernous sinuses and sphenoparietal, and also we have inferior petrosal and superior petrosal and sigmoidal and transverse and sinuses, and also we have as a single, we have superior sagittal and inferior sagittal and straight sinuses, and superior and inferior intercavernous sinuses and basilar sinuses. This is single.
Tell me why the sigmoid sinus is called sigmoid sinus. Where is it located? And it is joined from where to where?
Sigmoid sinus is in the sigmoid groove in the occipital bone, and it is a continuation of the transverse sinuses, and with the inferior petrosal together forming internal jugular vein.
Okay, good. Jugular pulp to internal.
Jugular bulb, yeah.
Okay.
Sorry.
Right. Can you please tell me how CSF is formed? Cerebrospinal fluid is formed.
Okay, we have in the subarachnoid space, we have subarachnoid capsules of the subarachnoid villi.
Yes.
This like produce CSF and
Okay.
will be circulated in this area and in the all the venous sinuses.
From, if you can tell me the course of the cerebrospinal fluid from lateral ventricles to lateral ventricles.
Okay, we have two lateral ventricles. Then it will be in the foramen of Marno, interventricular foramen of Marno. Then will be in the third ventricle.
Yes.
From the third ventricle, we have aqueduct of sleeve, and then will be to the fourth ventricle, and then will be go for three places at the middle foramen of Magandi, and at the two side, the two lateral foramen of Loshka.
Yes.
And then to be to a subarachnoid space or subarachnoid villi to
arachnoid villi and then superior sagittal sinus. Okay, very good. Can you please now tell me about how the blood-brain barrier is formed?
Blood-brain barrier.
Okay, you can come back to this one later. Can you tell me how circle of Willis is formed?
Okay, we have internal carotid artery and vertebral artery together forming the circle of Willis.
Yes.
We have posterior cerebral artery from the vertebral circle connecting with the posterior communicating artery of the internal carotid, and also we have internal carotid artery itself, and we have anterior cerebral artery, and between them we have anterior communicating artery, both sides forming the circle of Willis.
Good. Okay. Can you please tell me if you can if you can tell me what are the indications when you ask for a carotid angiogram?
Again, the question?
Yes, what are the conditions or what are the indications for asking for a carotid angiogram?
Okay, if there is a sign of like thrombosis, or also if there is